Hello, and welcome to Just Therapist Things, where we talk all things therapy. My name is Jordan, and I'm a licensed marriage and family therapist from California. I'm a private practice owner of Vital Mind Therapy, where I see clients virtually and in person. I also lead support groups for a nonprofit cancer support organization. Thanks for listening. Disclaimer, this podcast episode is just for entertainment purposes, not meant to be used to diagnose and treat real people. Overdiagnosing is a big issue, so I'm only analyzing and diagnosing based on how the character presents on television or in a movie, and if it warrants a diagnosis, in my professional opinion. Hello, and welcome to my fourth episode in my series of Diagnosing, where I, a licensed marriage and family therapist, analyze and, if necessary, diagnose fictional characters from TV and movies. Today, I will be exploring and analyzing the already established diagnosis for Miranda Bailey from Grey's Anatomy. So, if you are listening to this episode and don't know what Grey's Anatomy is, where have you been? Grey's Anatomy is a world-renowned show about the lives of doctors. There have been 20 seasons of Grey's and 430 episodes. I have proudly or guiltily, watched all of the seasons and will continue to watch when it returns in September of 2024. Let me tell you, over the course of 20 seasons, these people have been through so freaking much. Gruesome deaths of the doctors and patients, a plane crash, an active shooter in the hospital, cancer diagnoses, lethal hospital supply shortages, and more and more and more and more. In addition to just being doctors and surgeons, which in itself is an incredibly taxing profession. My fiance is a surgical resident currently, and he actually says that Grey's is usually pretty accurate when it comes to diagnosing and treating characters on the show. But the chaos and drama that happens in the hospital is totally fabricated, at least compared to the hospital where he works. I don't know what it's like at other hospitals, but I would love to hear if anyone has similar crazy experiences working in a hospital that the people in Grey's Anatomy do. Overall, I think that Grey's has done an incredible job at commenting on current and real-world challenges, from COVID to reproductive rights to mental health. Clearly, with all that happens in the show, you can expect that the characters will have challenges with mental health. And there's actually a ton of mental health talk in the show, and they do a really great job at showing ways to address mental health concerns among the patients and the doctors. A quote from an article written by therapists at the Integrative Psychotherapy Center puts it well. This quote says, "Grey's Anatomy did such a good job that in 2019 it became critically acclaimed for the accurate and innovative way that it approaches mental illness, mental health struggles, and its interplay with overall health and wellness. It is ingenious how the show so precisely depicts the interconnectedness of the mind and body. Bailey's character so accurately depicts the detrimental impact of cumulative stress on mind and body, as well as the additional ramifications of continuing to ignore and repress that stress." End quote. So this podcast episode will be structured a little differently because if you have seen the show, you know that Bailey was given a diagnosis of obsessive compulsive disorder, or OCD. So I don't need to diagnose her because she's already diagnosed, and I agree with this diagnosis, but let's analyze and break down the diagnosis. Just a little side note, I absolutely love working with people who are experiencing OCD and using ERP, CBT, all of the treatments with them, which I will go over further along in the episode. This disorder is so fascinating to me, and the treatment is so fun. Well, at least it's fun for the therapist. So first, what is OCD? OCD stands for Obsessive Compulsive Disorder, and it is in the anxiety disorder categories. The DSM-5 says that OCD is the presence of obsessions, compulsions, or both. So you can think of obsessions and compulsions as if you had like an itch from a mosquito bite or something. So the obsession is the itch, and the compulsion is scratching the itch. So the obsession part of OCD is kind of what is causing the distress, and then the compulsive behavior is the action or behavior that that person does in order to minimize discomfort around the obsession. And obsessions with OCD are most commonly revolving around the fear of something bad happening or just the overall feeling of needing to feel just right or for everything to be perfect. So, according to the DSM, obsessions are defined as recurrent and persistent thoughts, urges, or impulses that are experienced at some time during the disturbance as intrusive and unwanted and causes anxiety or distress. So, they are also defined by an individual attempting to ignore or suppress the thoughts, urges, or images, or neutralizing them with another thought or action, which is the compulsion. So the compulsion can be a repetitive behavior such as hand washing, checking, or it can be a mental act such as counting, repeating mantras or words, praying, something like that. It's anything that an individual feels driven to do in response to the obsession. And the behaviors or mental acts are aimed at preventing or reducing the anxiety or preventing a situation or something like that. Obsession is telling you is going to happen or might happen if you don't do this compulsion. So, a key part of OCD as well is that the behaviors or mental acts that are the compulsions are not connected in a realistic way to what the obsession is. And they are clearly just excessive and don't really make sense. Another criteria in the DSM for OCD is that the obsessions and compulsions take more than 1 hour per day, or they cause clinically significant distress or impairment in social situations, occupational situations, or other important areas of functioning. And the OCD symptoms cannot be explained by another mental disorder or any substance use. So that is what the DSM says about OCD. And OCD is pretty tricky, honestly, because there are so many different subtypes that I'm going to talk about in a moment. And OCD really presents differently for each person. So sometimes it can be mistaken as another disorder. Sometimes it can be really hard to treat or diagnose. It really just depends on the person. Some of the more common OCD types are contamination OCD, checking OCD, harm OCD, and just right or perfectionism OCD. There are also different subtypes such as relationship OCD, sexual OCD, and pure OCD. So again, there's so many different types. They all manifest differently. And how I like to explain OCD with my clients is that OCD is kind of like whack-a-mole. So that game where the mole pops up and you have to hit it with a mallet. And when you hit down one symptom or one type of OCD, it is very common that with OCD, another symptom or another variation of the disorder will pop up. So you kind of have to keep just hitting them down and keep treating whatever symptoms show up. So as the DSM definition stated, for these behaviors to warrant a diagnosis, the behaviors must be interrupting daily functioning or they must be really distressing to the person that's experiencing them. Some ways that OCD can interrupt your life is when it causes you to avoid situations, for example, not going to the bathroom in public because of fear of germs, or it makes you late to work because you have to open and close your door 7 times when you leave, or it puts a strain on your relationship because you constantly have to ask for reassurance to feel okay. So as humans, we have little weird habits and weird kind of things that we do, and some of the examples that I mention in this episode may sound like some of the things that you do. And, most of it doesn't sound like a big deal. Like, for example, if, you play baseball and you do a little prayer or, wear your lucky socks before a baseball game or something like that, those are things that it's not a big deal. It's not distressing. It's just kind of a habit that you do. But with OCD, it is very differentiated because it is affecting your functioning. It is distressing to you. And sometimes it's hard for the individual with OCD to actually see that the behavior is distressing because they're just thinking, oh, well, it's, reducing my fear or my discomfort about this. So it's okay that I, am late to work because I'm not feeling anxious about someone breaking into my apartment or whatever it is. However, it is impairing some area of your life, and sometimes it takes someone on the outside to say to that person, like, hey, you may need help. And that's kind of what happens with Bailey, as you will see. So going through some of these subtypes specifically, contamination OCD is the most stereotyped form of OCD, and this is where people are afraid of germs, afraid of getting sick, or afraid of others getting sick. The obsession with this form of OCD is being obsessed with not getting sick or not touching germs, and the compulsion is washing hands, cleaning, or avoiding seemingly dirty places or people. When someone mentions the term OCD, then this is usually the type that people think of. And this is a very common type, but there are, again, so many different forms of OCD. And it's actually interesting because the checking, the perfectionism, and kind of the thought ritualization has been popping up more and more over the past few years. And I've actually seen that in my practice firsthand. So checking OCD is where you check to make sure that you did things right, or you check everything so that nothing bad will happen. This can look like checking for mistakes, checking for safety concerns, health concerns, etc. Checking that you lock the door multiple times before bed, checking that you turn the stove off, checking your work over and over again. And checking can also be mental rituals. So it could also be, let's say you're laying in bed replaying conversations that you had earlier in the day, or you're practicing what you're going to say, you're repeating phrases in your mind so that nothing bad will happen. It's just that ritualistic checking, making sure that everything is okay. And just right or perfectionism OCD is the type that Bailey has. So this is when a person has obsessions or intrusive thoughts about everything needing to be just right or organized or perfect, and they do compulsions to make that happen. Often it's really hard for the person to know why they are feeling this way, but it really is just a feeling. It's just this discomfort if things don't feel just right or perfect. Usually these actions, these compulsions that people do for the just right or perfectionism OCD, they don't really seem as logical or connected to the obsessions as maybe other subtypes of OCD, such as with contamination OCD, washing your hands, or checking OCD, checking the stove. But just right or perfectionism OCD, as I said, it's just kind of like a feeling, and it manifests in different ways, such as kind of doing odd behaviors, like you have to touch your door every time you walk through your bedroom, or you have to get dressed in a certain way, or rearrange your work materials in a certain order, just because it feels right. The underlying anxiety for this, and pretty similar to the other subtypes as well, is just a feeling of being unsettled or uncomfortable if you don't do the compulsion. And you need to do the compulsion to feel less anxious or to feel more comfortable. Part of this type of OCD too is fixation with physical sensations. So, for example, needing to have your sleeves the same length, or tapping every finger on your desk in the same way. So again, it's not explainable, it's not really logical or realistic. It's just the feeling just right, or feeling okay. So let's talk about Bailey and Bailey's OCD specifically. Bailey has always been a tough, persistent superwoman. Throughout the show, we see her transition as the only Black female resident during med school who was smart but kind of hid in the background, to a tough, persistent, taking no crap chief of surgery. We also see that Bailey has a soft side and deals with so much over the years, such as racism, sexism, loss, relationship issues, divorce, and personal challenges with the medical system. All that she's been through starts to weigh on her mind and body, and during season 10, we begin to see Bailey struggling. Bailey's OCD symptoms start after a situation in the hospital where she transmitted an MRSA infection to a patient due to her gloves having microscopic tears with no fault of her own. It was just the gloves being, they're just manufactured in a weird way, and she transmitted this infection to a patient. So this was, of course, really distressing for Bailey, and her OCD began to show with behavior that wasn't super clear-cut OCD. I mean, it wasn't so severe that people thought that there was a problem. So, for example, she just started to wash her hands a little more often, especially before surgery. She would just really, really make sure to clean her hands. And so people just thought, oh, it's because, she had this infection and she's just wanting to be cautious with patients. So no one really thought anything of it. And then she started to pack and repack her purse over and over again, like before she would leave for work in the morning. She would just check to make sure that everything was there. So that, seems kind of normal. She's just packing her purse in the morning. And she also started picking her nails, which is a behavior that a lot of people do. So it didn't seem super concerning. But then the behaviors got more intense and noticeable, where Bailey would scrub her hands until they were raw. She started obsessively and constantly counting her fingers, and she started to display more odd checking behaviors with rummaging through her son's room at 3 a.m. to see if he left a piece of food in there, or dumping out her purse in a panic and checking her items. When the behaviors got more intense, this is when others started to notice, and that's when the behaviors began to interfere with her work. So she does have some little checking OCD happening, but most of it is kind of just unexplainable behaviors, and there's some contamination in there definitely too with the infection and the hand washing, but most of it is her feeling like she just needs to do these compulsions in order to feel just right. So she also starts to rearrange her tools, her surgery tools, in a certain way, and it gets really distressed if they get messed up at all. So just needing everything to be right. Bailey was very resistant to help at first, and she would not admit that something was wrong. And it seems like it wasn't explicitly said, but it seems like she felt kind of weak if she did need support or did need help, and she didn't want to show that weakness. She wanted to act like everything was fine and be that superwoman that she's used to being. But little did she know, I mean, she found out pretty quickly that actually admitting that you need support and taking that help is a huge sign of strength. Here is a clip with Bailey, Meredith Grey, and Owen Hunt in a surgical room. So there's an actual body on the table already, under anesthesia, and Bailey's getting ready to cut. And Hunt and Grey know that something is wrong, and they attempt to remove Bailey from the surgery. So here we go.
Bailey, can we speak for a moment?
I'm about to get started here. Why don't I track you down when I'm done?
This is a conversation we should have now. Dr. Gray can take over. Bailey.
I will speak to you when I am finished.
Yeah.
Do you mind?
Dr. Gray, please move Dr. Bailey's Bovie 1 inch to the left.
Don't touch.
Section 1 inch down.
Get away.
Maybe
from my
forward.
Get away from my table.
As you can hear in this clip, Hunt is kind of directing the whole thing, and he tells Meredith Grey to move Bailey's surgical tools. Basically, they're trying to show Bailey that something is wrong and that she needs some sort of help. And you can hear that Bailey has a big reaction. And after this reaction, then they finally get her to step out of the surgery room. So the hospital decided to put Bailey on some sort of leave or, pause in her work while she got her symptoms under control. Bailey was not happy with this, of course, and she wanted to continue working, and she felt like she could manage her symptoms, but clearly she could not. So she was assigned a therapist, I think maybe a psychologist. I'm not exactly sure what type of doctor or a therapist, but this person is named Dr. Alma. And Dr. Alma would help Bailey with her symptoms and do treatment with her. Bailey is very resistant to treatment at first, but she tries to comply just so that she can get back to work. And she's also very resistant to medication. So they start with therapeutic treatments initially. So here's a clip of Dr. Alma using exposure response prevention, or ERP, with Bailey.
It may surprise you to learn that I am quite good at sutures.
It wouldn't surprise me in the least. What would surprise me is if you were able to do 5 of them without engaging in OCD behaviors.
And if I can, you'll sign off so I can go back to work?
That's the deal.
5 sutures. That's all.
That's all.
Game on?
Just a sec. Now, only use the tools to your immediate right. If you touch any of the trays, we start over. If you count your fingers, if you double check a stitch, if you rearrange any of the instruments on the trays, we start over. 5 sutures. Whenever you're ready.
So without watching, it may be difficult to get the full picture, but what was happening in this audio was that Dr. Alma had Bailey set up in a room and told her that when she could complete 5 sutures on a dummy, she will be allowed to go back to work. It is important to note that this is following other exposures that Dr. Alma had started to do with Bailey. So this wasn't the first thing that they did. It wasn't just Dr. Alma saying, okay, you have to do this one task and then you can, go back to work. They had been working for a little bit beforehand. And I will go over more of exactly what ERP is. So in this clip, Bailey, at first, she feels like doing 5 sutures is such a simple task. She's done this a million times. She can do it in her sleep. So she feels really confident initially. However, before Bailey begins, Dr. Alma messes up her tools and tells her that she has to do the sutures without rearranging her tools or touching her, whatever the tools are laying on. And if she does rearrange her tools or touch the thing that, whatever that her tools, the plate that her tools are on, she needs to start over completely. So Bailey her face says it all, but I mean, right when Dr. Alma messes up her tools, then Bailey is basically like, oh shit, like this is going to be really tough. And you can see that she feels uncomfortable right away. It ends up taking Bailey hours upon hours just to complete a few stitches, and she actually never gets to 5 because her need to feel just right and her inability to control her discomfort is so strong that it affects her ability to complete the task. She can't focus on doing the sutures because she is so focused on the tools that are messed up, and she has to make them even. So Bailey feels really defeated following this experience, and she finally admits that she needs help. She might need medication. She needs to do more intense therapy in order to get over these symptoms and to confront her OCD. So this brings me to treatment. How do we treat OCD? So the purpose of treatment for OCD and for a lot of anxiety disorders is to confront and not avoid the discomfort. So you want to retrain your brain to know that it does not need to do the compulsions and it does not need to have the obsessions in order to feel safe, in order to feel clean, in order to feel okay, whatever it is. The best treatment for OCD is medication along with therapy. The most common medications used to treat OCD are SSRIs, and this is what SSRIs do is they increase the levels of serotonin in your brain. Most types of antidepressants are used to treat OCD, most of the common ones you can think of. And cognitive behavioral therapy, or CBT, or exposure response prevention, ERP, are the most effective therapy treatments for OCD. CBT for OCD directly confronts the distorted thoughts that come with the obsessions part of OCD. CBT also disrupts the associations between the thoughts and the ritualistic behavior of the compulsions. And it teaches different ways of thinking and different coping tools to deal with the stress and the discomfort. ERP, as you just heard with Dr. Alma and Bailey, is where you purposely confront the distressing item or feeling or situation, and you try to sit in the discomfort to teach your brain that you can ease discomfort by confronting rather than avoiding. And when you repetitively sit in the discomfort, these situations or the items or the feeling will start to not be as uncomfortable as it once did. So this will show your brain that you can handle discomfort and you can be okay and you don't have to avoid it. And the exposures increase in intensity as the person learns to manage discomfort at each level. I have done a lot of exposure therapy, and some that I have done with clients sounds super weird, but honestly, ERP is so successful and you see just incredible results. So some of kind of the weird sounding ones that I've done include listening to sounds of vomit for emetophobia, or wearing funny costumes around a mall for social anxiety, or making a purposeful mistake on homework, and much more. And as I said in the beginning, this is honestly really fun for the therapist because you can be creative and you do these kind of funny things. And honestly, sometimes it can be fun for the individual. Usually it's really hard at the beginning and, throughout. It's very difficult. But that's why you need a therapist to just guide you and be there to support you. And the therapist also needs to know when the exposures get to be too much and what you do about that. So do not do exposure therapy on your own. Definitely do it with a professional. So when Bailey starts to take her meds in conjunction with therapy, she is able to manage her OCD. And 10 seasons later, she is still on the show and she is doing great. So to end this episode, here is a quote from Bailey herself. Miranda Bailey says, "I have a big job where I do big life-saving, miracle-working things, where I lead others so they can do their big life-saving, miracle-working thing. And yes, I have obsessive compulsive disorder. I'm not ashamed of that. But it is not my whole story. It is just one piece. And if you continue to look at just that one piece, if you check that mental illness box and refuse to look at anything else, then I'm not going to live long enough to finish the rest of my story." So this is a very powerful quote by Bailey, where she's basically saying that yes, OCD is a part of her, but it's not all of her. And she has learned to manage it and she can live with it. And she does not want to be defined by her OCD. However, she acknowledges that it is a challenge and she has sought support for it. Thank you, Bailey, and thank you, Grey's Anatomy, for talking about mental health so eloquently and normalizing it and putting it out there for millions and millions of people to see. If you or someone you know is struggling with OCD, please reach out. Do not try to treat it on your own. And also know that you are not crazy and you are not alone. I will put some resources in the episode details. And please, as always, feel free to DM on Instagram or write a comment of what you thought of this episode. Thanks for listening. If anyone listening is struggling with their mental health, please call 988 or 911 to get help, reach out to loved ones, and know that you are not alone. Thank you for listening to Just Therapist Things, and I will talk to you soon.